Hey, it's Laura Boozer. I am waiting to do a work Zoom call interview and thought what better time than now to pull out your bag of balls. This is my preferred melt method balls. Large soft and small soft if you have it. We always start with an assessment, so grab that large soft ball, put it in your right hand, give it a squeeze. What do you notice? Tension, discomfort, tightness anywhere in the knuckles, fingers, wrist, forearm. Come to the left side. Assessments are so important, guys. We assess, we treat, we reassess in manual therapy when I'm working on a client. So do it for yourself. What do you notice on the left side? Same thing? Anything different? Okay, now let's get to the treatment. Grab that large soft ball. Let's start with some precision here. I want you to take that large soft ball, put it in your palm. The focus and the goal is to go straight center. Fingertip, finger pad, all right? And then move, fingertip, and then finger pad. Now, listen, it isn't about strength of this. It is about the precision and accuracy and being able to bend every knuckle. So when you get to the ring finger and the pinky finger, if you don't have what it takes to do it right now, today, you're going to use both because it's more important to do the action than worrying about any type of strength. So you notice I'm also holding the ball. I'm gonna go back through fingertip, finger pad, fingertip, finger pad, fingertip. Oh, I can feel my neurons firing. Finger pad, and then into the thumb. Fingertip, finger pad. Switch hands. Fingertip. Now this is my non-dominant, so haven't done a good treatment like this for a while. So I am gonna help myself do it correctly by holding the ball just slightly. Fingertip, finger pad. You notice this ring finger is like, let me help you out. And if you were to do this a couple times a week, you could do it every day. You'll notice really quickly that you'll create a new neural pathway. That's the goal here. And you won't need to assist yourself by holding the ball or doing 2 fingers at a time. Okay? Now, put that one down. Take your little soft ball, put it down into the webbing, and we're going to contract. I want you to notice when we squeeze the 2 tendons that are coming into play here. And we have these tiny little muscles that run inside our hand. You're going through each webbing while I'm talking here. Give them a little pump 3 to 5 times, move it again. But adducting the fingers like this is not a normal action that we do. You don't use it, you lose it. We're juicing up, hydrating on a cellular level all the connective tissue down here. We're also firing, making a connection to the brain to say, hey, more muscles in here can work than what I'm using currently. Okay. Now this one is my favorite. Your brain is gonna say, let me come around here and cheat because this is a known pathway. But a lot of us have a lot of challenges and are feeding our muscles in this area. So I want you to take it to the side. So you see them going to the side, not the front. So put it in the webbing. You might even have to hold it and contract. So we are adducting, bringing the thumb to the side of the index finger. Beautiful, switch the sides. In between the webbing, little pump, 3 to 5 times. Nice, slow and even. Wake up those muscles. Hydrate all of that connective tissue in there. Every time there's a shear force, hydration happens. We love hydration in our connective tissue. That's how we get rid of this inflammation. That's how we retrain neural pathways. I'm working my way back through my knuckles again, all the way down to the webbing. Little contraction, 3 to 5 times. Nice and even. Now here comes that webbing in the thumb to the index finger. My brain is gonna wanna pull it around to the front because this is a strong pathway. We're trying to bring it to the side view, okay? And again, if you have to hold it, that's fine. It isn't about trying to do a balancing act. We're trying to wake up all of this tissue in here, a new neural pathway. Good, now put that down. Now we're gonna do a quick hand treatment. So I'm gonna put the ball between my hands because I only have about 1.5 minutes left. And I'm gonna glide. You see I'm just gliding, twisting my hands back and forth. Nice little even glide. Then our next step is the shear. So I'm putting it between my hands. You can see at the base of my palms and just give it a little squeeze. This might actually be one of the easier ways to shear the hands. Typically we do this on the table or on the ground, which you could very easily. And then I'm going to bring the ball between my thumb, thenar muscles, so the bottom corner, and just give it a little shear. Now this is also a great place to indirectly shear to work into the deeper tissue. I can stop and crisscross my fingers. I guess I could turn better where you can see me. Crisscross those fingers. Compress and wait, take a breath. And then I'm going to bring that ball down to the bottom corner. Guys, remember, this is not trying to squeeze the ball where you're recreating more tension. Just an easy, gentle squeeze and shear. So if you're noticing up into your neck, you are working way too hard. We glide, we shear, we compress and wait. Take a breath. Good. Now we're gonna rinse. So I'm gonna pull this down. The rinse is simply chasing my little balls. Or rinse is put my hand flat. I'm gonna take this ball and I'm gonna run it outside. So let's go for a rinse. So let's go for our rinse. So let's go for the rinse. Hand is down here. You don't need to see me for this. I'm gonna run the ball from knuckle to fingertip, one direction. You'll notice, I just think like a coloring book. I'm going to top. All right, let's go for the rinse now. You can put your hand down on the table. I'm gonna take my other hand and I'm gonna run this ball on the outside of my thumb, top, and the inside. So it's a one direction. Outside of the index, top, inside. It's a one direction from the knuckle out to the fingertip. And you'll notice when I'm doing it, I'm also getting a one directional rinse on the hand that's working, the working hand. It's going up the inside of my palm while I'm intentionally working the outside, right? The top of the hand. So both hands are getting a nice little rinse. This is a one direction, nice and even. You notice I'm putting it on top of the knuckle and rinsing straight down. Rinsing straight down, so I get a better angle for that. And then switch hands. This will be easier to see. Outside, top, inside, outside, top, inside, outside of the middle finger, top, inside, go to your ring finger, outside, top, inside, outside, top. There we go, and work your way back. Then we're gonna rinse up the forearm. Rinse up the forearm. Rinse up the forearm. So we started at our knuckles, and we go all the way up. What's so awesome about this is how you really move that fluid all the way up the arm line. Get hydration all the way into the forearm, shoulder, neck. Pretty amazing. Then the last step, friction, 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 as light a pressure as you can possibly use. Honestly, if I don't have time to do anything but friction, mama is happy. So are my receptors, so is my lymphatic system. It's all happy. Re-squeeze, right? Completely different from when I started.